Hello everyone, today we'll see the difference between the low flux dialyzer and the high flux dialyzer. Here you can see F13 is the low flux dialyzer and HF18 is the high flux dialyzer. So what is the actual difference between these two? So there is a difference between the membrane permeability of the dialyzers. So for the low flux dialyzer, membranes are tighter, less permeable, and it removes mainly small molecules such as urea and creatinine. But in high flux dialyzer, highly permeable membranes are there and it removes small plus middle molecules such as beta 2 microglobulin. Then what is the another difference between these two? Ultrafiltration, that is fluid removal. For this dialyzer there is a limited capacity and it relies more on transmembrane pressure. But for high flux dialyzer it has a higher ultrafiltration coefficient and faster, more efficient fluid removal. Then the third difference is that clinical outcomes between these two. So for these, adequate for basic solute clearance but higher risk of long-term complications such as amyloidosis. But in this dialyzer, high flux dialyzer, better cardiovascular protection, then lower hospitalization and improved survival. There are no chances of amyloidosis in this. Then fourth difference is that dialysis technique compatibility. So what is that? So it can be used in hemodialysis, like standard hemodialysis in dialysis unit. But this can be used as the hemodiafiltration. Then it is suitable for high efficiency HD. Then the last and the most important difference is that the cost of these two dialyzers. So what is the difference between the cost of these two dialyzers? This is lower cost and this is higher cost. But even if it is higher cost, it can be justified to chronic patients due to improved outcome. So this is the actual difference between the low flux and the high flux. Thank you. Subscribe for more videos.